Well, good afternoon, everyone. I'm Matt Morrow, President of the Springfield Area Chamber of Commerce. Very glad to have you with us today, and I want to thank everybody for joining us on today's call and welcome you to this program, a timely program, given announcements that have been coming this week at the state and local level, and also the road ahead as many are preparing to reopen on Monday morning. It's the Road to Recovery Employer Considerations for Reopening. We have a great panel lined up for you today, and I'll introduce them here in just a minute. But as you know, Governor Parson announced earlier this week that a statewide stay-at-home order will conclude on May 3rd. That's a Sunday night. And the city of Springfield and Greene County followed that by announcing the first phase of our local reopening plan. And as you'll recall, local orders can be more restrictive than the state, but not less restrictive than the state. Think of a state order as kind of a baseline for every county in the state, kind of the lowest common denominator, and then those cities and municipalities make their appropriate regulations depending on their own metrics. So with all of these orders, the business implications that come from the situation that we are in, we know that our members have questions on the first phase of reopening, on how to keep employees and customers safe, and on considerations that you have to be thinking about with human resource implications. And I anticipate having that there will be many phases in the information that we provide you on the road to recovery, but this is the first of that, and it's just diving into the local orders and what that means for you as you reopen your business. So with us today are three experts in their field, great contacts for us, for this program, for you, who will walk through some of this with us. Mary Lily Smith is the Director of Planning and Development with the City of Springfield. Katie Towns is the Assistant Director of the Springfield Greene County Health Department, and Andy Hedgepeth is the Vice President of Human Resources with Cox Health. So I think we'll be able to cover a lot of really relevant ground for you today. We'll be hearing from all of them today and then conclude with some questions that we've captured in advance from you, our members, as you've emailed those in. We'll try to get to as many of those as we can today. And in addition, if you have a question that comes up just based on something you're hearing in real time on today's discussion, you can always email those today to Lauren Musto on our team. That's lmusto@springfieldchamber.com. That email address again is lmustoe@springfieldchamber.com, lmusto@springfieldchamber.com, and we will do our best to get to them. Although we do have a lot to cover already, a lot of questions that you've already gotten to us, and so hopefully that will anticipate and answer some of the ones that will be on your mind as we go through the program today. Also, earlier today, you should have received in an email PowerPoint slides provided for Katie and Andy's portion of the program today. Those slides can also be found on the Springfield Chamber Coronavirus webpage. If you have that email in your inbox, it comes from Lauren Musto. So that's also the email address that you'll use to ask your questions later. So thank you again to Mary, Katie, and Andy for joining us today. Let's go ahead and jump right in and get started with our program because I know there's a lot to learn from these panelists today. Mary, if I could, I'd like to start with you. Today, we know that the city and county have worked collaboratively with many community stakeholders to develop the first phase of the new reopening order. I wonder if you could just take a moment to outline what will change for Springfield on Monday and specifically how these guidelines differ from the state level guidelines, what people need to be watching.
Sure, thank you, Matt. I appreciate the opportunity to speak to chamber member businesses today. And on behalf of the mayor and city council, I want to also thank each of you for your cooperation, compliance, and your innovation during this very difficult time. We know that this is nothing any of us could have planned for, and I appreciate the nimbleness and the cooperation that you've shown. As Matt stated, on Monday, we move out of the stay-at-home order into what we're calling the Road to Recovery order. And I want to talk first about what our considerations were when we drafted this order. First and foremost, we looked at activities and businesses and tried to assess them in terms of density and intensity. How many people would be brought together? Could they maintain those CDC social distancing guidelines? Could they modify their operations in order to meet the guidelines? And what would be the duration of the exposure of people who were accessing those businesses or activities? Is there an ebb and flow of like when you're passing a customer in a store, or will people be sitting or standing in a static place adjacent to other folks for an extended period of time? One of the resources that we used, and Katie may be speaking to this as well, is the Johns Hopkins study that provides guidance for phased reopening. And it looks at specific settings for businesses and activities and assesses them in terms of contact intensity, the number of potential contacts, and is there a way to modify the existing business practice to mitigate the risk. And we use their rating to really rate businesses and activities and form our guidance. We also looked at the guidelines for opening America that were issued by the White House a couple of weeks ago, and of course the governor's orders. And we tempered all of that with our experience with exposures and cases. So as Matt said, local orders may be more restrictive than the governor's orders, and we have been from the very beginning more restrictive than the governor's orders, and that's a common practice among most of the major metros. And personally, I'm a big proponent of allowing local control and decisions to be made at the local level where we can shape our responses to address those local concerns and issues rather than having the decisions dictated from a more remote level of government. I recognize that right now, some of you may think that you'd prefer the more laissez-faire approach that the state's taking in addressing the issue. So where are we and where are we the same and where do we differ? We both include the requirement to follow CDC guidelines for social distancing, and hopefully that's just become a common practice across all sectors, the same as 20-second hand washing has. The state order addresses retail occupancy and sets limits on the number of customers who may be in the facility, and we've adopted those same occupancy limits. And the chamber has a great little calculator on their website that can help you figure out what your occupancy limit is. And all you need to know is the square footage of your building. And I will say that in this case, it's looking at the total square footage, not just your sales floor or the area that's open to the public. The state also provides some guidance for dine-in seating that we have adopted. So our order then branches off from that and becomes more specific and restrictive than the state in the following general ways. We define public gatherings as any planned or spontaneous event that could facilitate the spread of communicable disease, and we limit those public gatherings to 15 or fewer persons. You'll remember that our stay-at-home order was less than 10, so it's a slow step out, but it's adding 6 people to the number of folks that can be in a public gathering. We follow the governor's order on customer occupancy for retail establishments, but then we've modified that somewhat for personal care businesses, such as hair and nail salons, tattoo and piercing parlors, massage therapists, those kinds of services where it's really impossible to provide the service without getting within the 6-foot physical separation. And so in those cases, the maximum occupancy limit applies to everyone in the building, not just the customer. It applies to the employees as well as the customer. And employees must wear masks, and customers must wear masks or some kind of facial covering to the greatest extent possible while they're receiving the service. So for example, if you're getting your hair cut, which I know we all want to go do, you may not be able to have a mask on while your hair's being cut, but you could use one of the salon towels to just place over your nose and your mouth during that period. Restaurants may provide dine-in services with the same occupancy limit that applies to retail establishments. And that limit applies only to the folks who are dining in. So it doesn't apply to the wait staff, the cook staff, or anyone who may be dropping by to pick up curbside or takeout. Counter seating is prohibited at this time because of the proximity of customers to staff and food prep areas. And self-serve buffets and salad bars are not permitted. So those businesses that have previously had a buffet or a self-serve salad bar will need to modify their business practice in order to have dine-in services. We recognize that as businesses start to open back up again, that daycare is very important. So we've broadened the opportunity for daycare and day camps in this recovery order, where previously it was should have only been available to folks who were in an essential healthcare service. Now it is open for all. So all that's providing kind of gradual stepping out of the stay-at-home order. And I think that that's all really good news for everyone. Unfortunately, there are some businesses and some activities that we've identified as not appropriate to open back up at this time. And that decision was based on the guidance that I mentioned earlier, with heavy reliance on the consideration of intensity and density, that prolonged interaction of groups of people sharing the same space, which would enhance the risk of the spread of COVID-19. And we recognize that that impacts businesses and individuals significantly. And our great hope is that we have positive health numbers throughout this phase that will allow us to step out of it sooner rather than later. So first off, on churches, we received lots of requests during the stay-at-home orders to permit drive-in services, and this Road to Recovery order permits that. It also permits gatherings of 15 or fewer in the building. So small groups could meet. You could have a larger praise team that you're videoing for online services, etc. And then we have a series of businesses that just by their very nature are congregate activities. They're activities that we all miss, where we wish we could sit down with a group of friends and have a beer, or go bowling or go to a movie or something like that. And right now, those are our activities that we feel strongly should not be open during this first recovery phase. And so that includes things, entertainment like movies, concerts, live performances, dancing, arcades, gaming, bowling, billiards, and pool, museums and exhibitions, contact sports, including practices of teams, fitness classes and playgrounds, swimming pools before May 23rd, that's the Saturday of Memorial Day weekend, conferences and seminars, and bars, nightclubs, and brewery tap rooms. That last one really is the one that personally I feel the most, and I know that others do as well. So before I close, I want to note that we'll be monitoring our health indicator dashboard that I'm sure Katie is going to discuss. And our great hope is that we don't see the dials move into the red zone, and that we're able to move to the next phase of the recovery order before the current one expires on May 31st. And we're already discussing what will that next phase look like. And our plan is to publicize that well in advance so that everyone knows the landscape. Just a couple of references for everyone. The recovery order can be found at springfieldmo.gov/recovery. If you have questions about your particular business or certain business practices, you may call 874-1211 extension 3, or send an email to essentialbusiness@springfieldmo.gov. Again, thank you for your cooperation, your compliance, your patience, and the way that you all care for the community.
Sure thing. Thank you so much, Mary. Lots of really important overview there, and good content. More questions on this topic too, but I'm going to wait and come back to questions. So if you're submitting questions, please keep doing that. We're going to come back to questions here in just a minute. We're going to get an overview from the health and HR perspective before we come back to really trying to move through some of those questions. So next up, I'm going to move to Katie. Katie Towns, I'd like to turn to you if I could. One of the things we hear most from our employers is they're genuine desire just to keep people safe. And this is such an unprecedented challenge in front of us, a different health challenge. And we are not, most business people are not health professionals anyway. So we obviously can't stay closed forever, and nobody would want to stay closed forever. But as business leaders start to emerge, they want to know what they can do to be as safe as they can for their employees, for their customers, for the larger community. So I wonder if you could talk a little bit about some of the recommendations the health department has for businesses to help keep people safe and to mitigate the spread of infection as we work to start reopening our local economy. And then what can individuals do to take responsibility as well, Katie?
Good. Hi. Well, thanks everyone for having me and for having the health department here today. I'd like to just start by thanking the chamber and also thanking the community. Like Mary said, we could not have accomplished the control of this disease that we have been able to without the partnership from the community. And I think at this point, we are in a place where we feel good about this next step, and that is due in part because of the respect that the community has given to the necessary steps we've made to actually put things into a place where we're in control. As we start to step out, I think, it is important, and I'm so appreciative. We've had lots of people reaching out to find out what it is that is safest as we move forward. And all of those questions we want to be able to answer and help talk through so that you all are able to make decisions that are going to be good for your business and good for your employees. And so one of the things I think to sort of start with that we know at this point is that this disease hasn't changed. And until we get an intervention, something more along the lines of pharmaceutical intervention, we won't be able to guarantee that we have controls that will really help us to more freely move around with confidence. And so we have to take these steps slowly and sort of let things evolve and then move forward in a slow and measured way. And that's what Mary was alluding to, the fact that we've built a dashboard and we've worked with our hospital partners to make sure that there's comfort around the indicators that we're using to do that. But as we've learned a little bit about this disease, we do know that it likes to spread where there is close proximity, and so closeness in people, but also where people spend a duration of time together. And so we've been framing all of our decisions and our steps to move out of this on those sorts of pieces of science that we've learned about the disease thus far. And I think it's important that as you think about things to employ, as you bring people back to work, some of the most important things that we'll start to think through are looking at ways that you can mitigate, but also control if there was, for some reason, there happened to be an exposure inside of your walls. And I think when you start to frame your decisions around the fact that people coming into your business could be, and you might not even know, unfortunately, they could be carriers of this, you start to sort of frame your decision making and make the best steps in the safest way that you can moving forward. And so we would ask that people really still consider high-risk groups, that they would make accommodations as much as possible to have those folks work from home or work remotely so that we protect them, because we just don't have, like I said, the interventions that are necessary in order to create immunity to this disease quite yet. And so just to remind everybody, the high-risk groups that we still have in the COVID response are those adults over 60, people who have serious chronic conditions like heart disease, diabetes, and lung disease, and those who have compromised immune systems. And so, looking at ways that we can keep people remote and away from exposure is the safest approach at this point. And then as we continue through and start to plan for bringing people back into space, you'll see in the slides that I provided, there's a list of things that we can walk through. And a lot of those things are can be deployed in relatively simple manners as you think through preparatory sorts of things and opening your doors. So one of the things that we've been using here at the health department since the beginning of this process was that we instituted a check at the door for symptoms and fever, and we're using a thermometer to basically record temperatures on a daily basis. And I think as we move forward, those are good, sound practices that people should think about incorporating into daily use. Travel policies. We have a lot of cases here in Springfield that can be linked back to people traveling out of town and then bringing disease back into our community. And we know that within our state, even that there are some really hot sorts of communities with this disease, and we really want people to pay attention that if you do have to send people for travel, that you protect them and monitor them as they start to come back to work. And Mary mentioned this earlier, but distancing is going to be one of the biggest keys that we can provide as far as a safety tool in moving forward. So when you start to bring people back, looking at workspaces and helping to ensure distancing as much as you can, and even things like rotating schedules, moving spaces around, those are all the sorts of things that you can think about as you safely approach reopen. Leave policies. Andy might be able to speak more adequately to this, but thinking about things that will allow people to stay at home if they have symptoms that are correlated with COVID-19. And then if they are experiencing those symptoms, we want to make sure that we get them to testing as quickly as possible. And so as you start to bring people back and you think about how you're going to message and communicate to folks that start to feel not so well, we need to make mechanisms simple and easy for them to get connected with a physician, get a referral, and get over to a test site. Testing is very much available in our community, and we've been working very closely with our hospital partners to ensure that people who are feeling symptomatic are able to get over and get tested. And then cleaning. So cleaning guidance, we've had lots of questions about what is necessary, and we've provided some CDC-based cleaning guidance on our website. But thinking about instituting increased frequency of cleaning, and especially around shared use areas, so copy machines and doorways, light switches, doorknobs, all of those things that kitchen facilities, where people are congregating and using spaces frequently, we'd encourage that you use an increased regimen of cleaning as you start to bring people back. And again, things like groups and meetings and those sorts of things, using remote work options is still probably a best practice and will keep people safe. And so I think all of those things are sort of the recommendations that would be the high points and help ensure safety, but also allow us to open things up and start to figure out how this new normal really looks for us. So with that, I'll turn it back over to Matt.
Eddie, thanks so much, and thanks for the work that you and the whole team are doing on this. This is there's no, as much training as you have all had, there's no training probably for precisely what we're experiencing right now. It's I think we have a team that's second to none in that regard. I also want to turn now, if I can, to Andy. Andy Hedgepeth, Cox Health has done an incredible job, of course, leading as one of our major health systems in the community through this crisis, but also being one of the largest employers in the community. You bring the employment lens to the table also. And so in your role as Vice President of Human Resources for such a large organization, I wonder if you could just give us some of your thoughts for guidance and things to think about from an employer perspective as Springfield and the larger region move forward on this next step. Andy, what do you think?
Yeah, Matt, I appreciate that very much. I have to say that this entire effort has been possible in very large part to Greene County Health Department, our chamber, and our local governments that are working in partnership and a willingness to listen to science and use data as we drive decisions. From a people perspective, I'm going to kind of approach this a little bit from my lens here at the hospital, because this is what we've been dealing with for quite some time. This is not a business as usual environment as we're reopening. And I think it's important to ensure that we are taking necessary precautions. We know, again, that this is a virus that spreads because of proximity. And we know that it doesn't really matter if you are rural or if you are urban in terms of where you live and where you commute. It's proximity to one another. And that's something to keep in mind. I think as we kind of consider reopening, what that can mean in terms of vendor and customer engagement, which is going to be tantamount to our businesses for their survival, I think it's important to really look at this through a lens of what is essential and what is non-essential in terms of your vendors and customers, and really heavily scrutinizing who gets in, how they get in, and the processes that you are taking to make sure that you are safeguarding yourself and your employees with those customers. So, here at the hospital, we've been doing a mandatory symptom check. All individuals, doesn't matter if you are a vendor, it doesn't matter if you are a patient or a guest. Those obviously are significantly limited right now, or our employees. We've been doing symptom checks at the door. We are heavily requiring hand washing. I think one of the good outcomes from Corona is that I've seen more people washing their hands as they leave the restrooms than I think I've ever seen in my life. That's a good thing. We have to continue to do that. And above all, if we have someone who's showing that they are ill, we cannot let them in our businesses. I think that goes without saying, but you have to take a heavy stance on that. They cannot do it. I think it's an opportunity for us to be creative. There are drive-through options available. I know for our pharmacies, for example, we will run those out to you. We don't need you coming in our facility. You pull up, you call us, we'll bring it out to you. And I know a number of our vendors in the community have started taking similar stances with restaurants, with their takeout and things like that. I think creative scheduling is an opportunity for us to do social distancing, enhanced cleaning. I think when we consider calling customers for their appointments as they wait in the car, we're kind of taking that to the next level. I have a good friend in the community that has a business, and she called me asking my thoughts around how she could do this. And she's obviously going to make sure that she's masked, her staff is masked, and customers, but she wanted that extra step to really stipulate that her customers stay in the car until the last minute and call her, text her, whatever it is, and then they could come in one at a time. I think that's a collaborative option to try to keep social distancing as much as possible. On my slides, if you have those, you can see some of the steps we've taken with our barriers as well. Those are in our emergency department. We've used them in some of our other locations as well. Human resources is one. We have these barriers up. Just a simple piece of plexiglass that's held in place by some posts, but it's very, very effective at stopping the droplet spread for anybody that may potentially be carrying this disease. And remember, this disease can be asymptomatic, so people can be carrying it, not even know it, and spread it to others. So I think it's important for us to keep that in mind. When it comes to exposures in the workplace, I know from an HR perspective, employee health can oftentimes report up through HR. This is where the local health department is going to be our best friend and our ally. It's so important if we have exposures that we let them know. They have the professional sophistication to be able to do contact tracing where appropriate. And another important thing here is that for your exposed staff, I really, really stress that you follow CDC guidelines. They have guidelines in place to help you with these things. And that also goes for individuals who are confirmed cases on the return to work requirements. which they actually have just recently updated. So we absolutely follow CDC guidelines. I think it's paramount. And Katie talked a little bit about the terminal cleaning requirements. I think that's important as well for sanitizing your areas for anybody who may have exposures. Obviously, work in coordination with the health department on what they recommend, and also the manufacturer requirements for dry time. But those are some of the steps that you can take just to make sure that your workplace exposure is mitigated. I want to kind of shift a little bit here and talk on HR policy in particular. Again, I think this is a unique time in our society where HR can kind of step up and truly be a strategic asset to organizations and helping with the new policies and the procedures that we're having to come up with and pivot almost daily. But it's a unique blend of new and old. And if there's anything that you're taking away from this, it's just exposure mitigation. And you're going to see very quickly as employees are coming back to work in your businesses that levels of risk are going to take many different forms, many different levels. You're going to see that they come to you and say that I cannot work because I have a health condition. It's important to get your HR experts or your outside counsel that may advise you involved very quickly on those so that you can work through those. I will be the first to say I'm HR, I'm not an attorney, but I do consult with attorneys when we're making our decisions. I think it's important to have contemporaneous records in place. It's always important to document the conversation. I think it's important to stress confidentiality to your employees to let them know that you take their concerns very seriously. But it's also important to apply science and reason. And when you're starting to have dialogue with them about what is reasonable and what you can reasonably accommodate as a business for them, it's important to be able to help them understand the science behind the why you may be basing your decision. We're really lucky here at the hospital that we have the smartest people in the room, literally in every room. You walk around a corner, there's a doctor. So we have some luxuries here that I know some of you don't necessarily, but I felt like it was very important early on for us to pull that group of physicians together. I've got a multidisciplinary panel of them, and they are able to review and have this conversation with employees in a confidential manner and really make the recommendation back to HR. So they're serving as an extension of HR right now, but they have the medical science behind how this spreads, why it spreads, and truly an understanding and appreciation for what someone's condition is. So we know, for example, that just because you have cancer doesn't necessarily mean that you are at any higher risk than someone else. Now, if you have some types of cancer or you're going through treatment that may depreciate your immune system, then that's another story, and we need to have a conversation about that. And so it's important to really understand where that individual is coming from and really appreciate their circumstances. But when you're determining what's reasonable, it's going to be different position by position. And so let's use an RN as an example. So if that's someone that says that they need a reasonable accommodation, it may be working with a mask. It may be working from home. Well, as an RN, if they're doing televisits, that may be a possibility for us. But if they're delivering direct patient care, it's going to be challenging for them. They're not going to be able to do their job from home. So we may look at reassigning them to another division within the operation, maybe one that has less potential risk of patients. We may not necessarily want that person working in a COVID unit, for example. And ultimately, we may come down to you just need time off with or without pay. That serves as a last resort, but preserves their employment status and may help get them through what they need. Katie, you talked a little bit about remote work, and I think that flexible schedules make so much sense. And there are a number of things that you can do in that arena, I think, to be collaborative and creative. I feel like if you can adjust days that people work, why wouldn't you? If you can move to 410s and split out, so you don't have quite so many people in one place at one time, that's a very reasonable thing to do, presuming your business can accommodate that. If you could flex and start working, staying open on Saturdays or maybe Sundays, for example, again, it's about social distancing and getting some spread. So instead of having 30 people in an office, if you can move that to 15 or 20 by taking some of these steps, why wouldn't you? And obviously remote work just continues to be something we're seeing surging in society. People are showing that they can absolutely make it work. And you as a business leader just need to make sure you've got some necessary steps in place to make sure they're actually able to get their work done. But we very quickly here at the hospital moved upwards of 1,000 people off-site to work remotely. It has worked quite nicely, and we have been able to sustain it. So we're showing that can work. I'll talk a little bit about pay and benefits. You may be considering whether or not you need a COVID sick time policy. I know as I consulted a lot of my peers across the country, it became very clear for health organizations that they were establishing these COVID sick banks. We took that step as an organization. I know Mercy took that step primarily because as a healthcare provider, we need to be ready to take care of you. And what we did not want to happen was for pay for our people to get in the way of them feeling safe to voice to us that they're showing signs and symptoms. That's the last thing that we want, because then they are potentially showing up sick and it spreads significantly faster. We've got to be here to take care of you. So we created that bank. That may not be an option for you, but those are some of the points I'm trying to show you that we went down as we're trying to determine whether or not that made sense. You also need to consider how these new pay options may intersect with traditional FMLA or leaves of absence. We talked a little bit about the Americans with Disabilities Act. We saw a significant increase in the request for personal leaves of absence. Those are separate leaves above and beyond FMLA for us. And we saw the need to ensure we had additional mechanisms in place for our communication. So under a personal leave for us, for example, the department director can authorize that. It's an unpaid leave. We had a number of people who just felt like, hey, I want to take a personal leave. I'm going to get away for 2 weeks, 4 weeks, 6 weeks, and somehow this thing's going to be gone and I'm going to go back to business as usual. That's not going to happen for what it's worth, but that was the rationale. And we had some leaders that signed off on that because they were reducing their census. We didn't have as much volume of business here in the wake of slowing down some of our elective procedures. So that can make sense of allowing people that time off. But on the other hand, we had a significant need for new greeter positions that we had to create. We're running those 24/7 here at the hospital so we can make sure that we're temp checking everybody when they arrive. And so we actually needed those individuals to help fill other roles. And so we found very quickly we had to have a way of making sure that those department leaders were in contact with HR so that we could make sure we were coordinating leaves appropriately where we could grant them. The CARES Act obviously created a wide-ranging number of benefits available, many of which are temporary. They're designed to be temporary, but for some of you, you may offer a qualified retirement plan as part of your benefits package to your employees, and so we know that there are in the CARES Act there are early distribution waivers so that the 10% traditional excise tax, if you're under 59.5, has been waived for this year. Required minimum distributions for those that are turning 70.5 have been waived. And then loans, there's a loan provision that allows you to take upwards of $100,000 borrowing against your retirement account. Now, in theory, some of these make really, really good sense, but in practicality for us, if you have an individual who has saved their entire career and now they're going to borrow $100,000 with the appropriate intent to repay it, but they only make maybe $2,500 to $3,000 a month, let's say. And we know when they return, the repayment over 5 or 6 years for that loan is going to be 5,000, we're setting them up for disaster. So it's just important to think longitudinally, not just for the short term, on how these benefits are going to intersect, and how they may or may not benefit an employee long term. We know from a health plan perspective, there are a number of things that the CARES Act did for covering televisits and COVID-related testing, waivers for over-the-counter medications and things like that. I think it's important for you to touch base with your third-party administrator or your health carrier to really understand what they are adopting. Obviously, if you're a self-funded employer, you can make that call for yourself. But it's just important to be appraised of what's going on. We do know that the educational assistance taxation requirements were relaxed by the IRS as part of this act as well. And then, the flip side is, as you're bringing them back, you may not need them full time as you try to scale back up. And so things like the traditional state of Missouri unemployment benefits that for the last several years, we've been in a really solid economy in Missouri. We may not be as familiar with what those laws look like right now. So I think it's important to brush up on what max weekly benefits look like, partial benefits, programs that the state is offering, and then the $600 per week up to 13 weeks retro to January from the Fed as part of the CARES Act, through a nice bone out for employees, I guess I would say, if they qualified for unemployment. So there are benefits that sometimes may be a last resort for us, but can provide a really good safety net for people that you as a business might be able to help your employees take advantage of. And then finally, I'll touch quickly here on an approach to travel. I will tell you that our stance here at the hospital has continued to be that travel is just generally not a good idea outside our region, at least right now. And I think that's important. I think, our airlines do a fabulous job of very safely getting people across the country very quickly. But I really don't want our employees to be on airplanes right now contained in an aerosolized environment with the potential for COVID, simply because they can bring it back to our area, they can bring it back in our business, and it can spread from there. So, we have not taken the stance of saying you absolutely cannot travel, but we have set up a committee, again, using that same physician committee. They're very well appraised of where the disease is prevalent and can review. And sometimes we find that they can make a very, very good, reasonable, accommodating request. We know that if there are times where individuals are losing loved ones and maybe they only have a few days to live. It's important to weigh whether or not they need to do that, and if they need to go, then certainly they go. But we've left it on the backside that we do follow those CDC guidelines. And when you return, if you come through that area, we have to recognize you may have a risk to us for upwards of 14 days. So we've reserved the right to place them off so that we can make sure that they don't contaminate. If they can do their job remotely, again, that's another option for you to consider. But I think if you can pull together a advisory group, a board, a few people out of your organization, that they can blend that pragmatism with that compassion. They can avoid the tunnel vision. They have different perspectives and considerations of what's going on. And above all, the ability to communicate with your employees with open lines of communication. And we've taken the stance that we need your itinerary. We need to know the dates. We need to know the locations. What waypoints are you going through? Who did you come in contact with while you were there? Have they possibly had exposures? I know some of that feels like it's a little invasive, but man, we really have to be very careful about this so that we can really control this. We've done a great job in our community of keeping the spread of this contained, but we cannot kid ourselves to think that we have immunity. We do not. So we have to do everything we can to distance ourselves as much as possible where it makes sense. And then, kind of the last piece here is just the pivot away from the policy to the humanistic piece. As business leaders, it is so critical for us not to underestimate the stress level our people may be under. They have lost wages, they have bills due. Don't even get me started about homeschooling our kids. I have an unbelievable appreciation for our educators, what they go through. So our people are going through a lot right now. And I think it's important for us as leaders to ensure that we're checking up on them, asking them how they're doing, asking them if there's anything that they need help with. And then finally, for you as the leader yourself, Jim Anderson actually sent me a really awesome article a little bit ago from Harvard Business Review. It's free, and I would advise everybody go out and read it. It's called How to Handle the Pressure of Being a Manager Right Now. You're going through some unprecedented times. These are the things that we hope we never even see in our career. We read about it in books. We are writing history in real time right now, and we will be remembered for our actions. And I think it's so imperative for us to make sure that we are taking good care of ourselves and taking the necessary steps to ensure that the next generation can take the reins when it's time. So those are a few of the things that I would say we've been doing collectively at the hospital I think are working. I'm, again, fiercely proud of this community and for all of you with your efforts that you're doing. And I would just say keep it up, and thank you for the opportunity to share.
Thanks so much, Andy. A lot of ground in several different areas today, and I know we have a lot of questions I want to try to get to as well. So we had scheduled the call to go to about 2:00. We may go 5 or 10 minutes over that. Of course, if people need to drop, they can. But I want to get to as many of these questions as we possibly can. Andy, since you just left off, if you have a very just a quick answer to this, or at least some guidance on this as an HR professional, one of the questions that we've received is just, how do you manage and try to protect the safety of high risk employees, people who are high risk for COVID, because either they're older or they have some pre-existing health condition, and still balance the age discrimination concerns and or health privacy concerns that are out there? I mean, how do you treat people differently because they're older or because of health conditions that are supposed to be private?
Well, what we do know is that age in and of itself is not necessarily the sole determining factor of whether someone is high risk for this disease. That's one thing that I have taken away from our medical doctors. But I think it's important that HR be involved with these processes. The more you can do to review in a closed format, so that group of individuals, like obviously ours are doctors, but for us, they understand confidentiality. You can make those individuals understand confidentiality. They're an adjunct, an extension of human resources. So that's just one idea. If you think you've got it from an HR perspective, then handle it yourself by all means. You don't necessarily have to broadcast to these large swaths of people.
Okay. I'm going to pivot back to Mary and Katie on some questions specifically related to the order, and there are a lot of them, as you know. And one of the things I'm going to ask you to do is to share the business hotline one more time before we wrap up, so people know where they can follow up also. But a couple of times earlier it was mentioned the metrics, the dashboard that the health department has shared. I know that we know more today about incubation periods for the virus. So here's the kind of the $64,000 question. If we are watching those metrics and those metrics are doing well, how do we know when it's time to move to step 2? How will we know that?
So I think that's a great question, and it has to do with a lot of different factors. But sort of at a high level, what we have to monitor is one, case counts and the number of cases that we have come in on a daily basis, and then our ability as a health department to conduct investigations. And then you've heard a lot about this concept of contact tracing, but that's what we do. And when a case comes into our department and we conduct an interview, we look for the amount of exposures that have taken place from that positive case. And sometimes people have limited exposure, but as we start to step out of this thing, we expect that the amount of exposures will increase because people will be able to more freely move and go to, go to work or go shopping or do things that are more of a normal concept of daily life. And so what our job then is evaluating all of those places that a person has come into contact with other people that are perceived to be healthy, and determine if those folks then need to go into a quarantine situation and monitor for disease development. And with that process, then, if it is determined that a person has been exposed, we will put them into a quarantine situation, and we will touch base with them twice a day and monitor them for symptom development. And so you can see where our capacity to control and to mitigate disease with those tools can quickly stretch our capability to handle that with the personnel that we have. We are looking at opportunities to expand our capacity to do that, but that is a process, and so we won't have that available to us immediately, and we just have to sort of operate within the context of our capacity to manage. The other things that we're watching are our hospitals' ability to respond, and so their ability to provide staffing, to provide PPE, and to allow for cases that would need additional health care. All of those resources are incorporated into the dashboard that we're using to evaluate how we step forward, and we need to keep those resources available and able to deploy them readily. And then one of the final things that we're watching is that Springfield, Greene County, really, we care for the public health and in the entity of Springfield and Greene County, but we know that because we have healthcare resources here and they're very rich and robust, we have a lot of people that seek healthcare in Springfield, and so we know that we have to monitor not only Greene County but all of our region here in Southwest Missouri, and sometimes that pulls from as far as Oklahoma and Arkansas. And so we have to monitor the disease spread in some of those outlying counties and really watch for incidences that will indicate that we need to be more ready to respond should something sort of get out of control. And so a lot of information is going into these decisions. But over the course of the next couple of weeks and watching what disease does as we step out of this slowly will really help determine our path forward.
Katie, is it right to expect some level of even a manageable level of increase in infections as we start interacting with each other more again?
Yes, I think that's a very likely assumption. We know from historical instances of watching pandemics that there are always second spikes. And so we know that we've sort of overcome our first spike of disease, but there will be more spread. And our goal is just that we stay in control of that and that we watch our resources very carefully so that we don't have to go backwards. We'd rather sort of step out of this slowly and control it and stay the path of moving forward.
Great. Mary, I'm gonna pivot to you just a little bit as well. You mentioned in your comments a desire to have as many specifics as possible about step 2. And of course, step 1 takes effect on Monday, but step 2, the particulars of what that world will look like those are going to be really important as businesses prepare and plan for how maybe those who can't operate under step 1, how do they prepare to be ready under step 2? What kinds of limitations are they under? How do you see that playing out? Do you see this as something where you can essentially signal the particulars of step 2 with enough lead time for businesses to prepare for that?
I certainly hope so. And actually, we had a conversation yesterday afternoon after the press briefing and the Facebook Live event about how we need to start working on what the next phase looks like immediately. And so that's, unfortunately, immediately wasn't today, but we're going to start on it next week, really starting to look at how do we walk back out, and is that an incremental increase of 25 more in occupancy, or do we step out a little bit more than that? What of those prohibited business activities do we allow to occur, and are they allowed? Is it flipping the switch so it goes to 100%, or is it again an incremental step out? But I think that I know that there is a strong desire here at the city to work through those issues and to be able to signal that out to the business community and the general public, so that it's like, well, if we meet these health metrics, here's what the next step's going to be. We have some good models from other communities in the Midwest who've prepared some information like that. So I'm really hopeful that we'll be able to unveil something like that really soon.
Just a quick follow-up on that, and then I have a couple more for you, Mary. A lot of questions about which businesses can and can't operate right now. Obviously, a lot of that's been covered. We know barbers and salons can operate under certain PPE protections. Car washes, those are good. Yes, those are good to go.
Absolutely.
Okay. Obviously, so gyms. My understanding is that you can work out, you can lift weights, you can run, use the cardio equipment, but you can't be in classes. Is that a accurate assessment?
That is correct. That is correct. And I'll say that we've had a lot of calls and feedback on that just in the past 24 hours. And I want everyone on the call to know that we take all of those calls really seriously. And a lot of them have been very thoughtful calls in saying, okay, I understand that you're saying, for example, that fitness classes are not permitted. Let me tell you how I think this could work and achieve your health goals. And we're listening to all of that and having conversations internally about, what would make the most sense, and is it appropriate to consider modifications to the order? I can't promise anything, obviously. I don't have any kind of authority in that regard.
Well, I'm glad you kind of addressed that, though, because that's a question we're getting to. Is there I don't think an appeals process is probably the right way to describe it, but what I'm really hearing is what you're describing is there are people who have been actually, especially non-essential businesses have been shut down for a while, who have been thinking a lot about a way that they could do this. And so are there ways that those businesses, those industries could approach someone? Is it you? Is it who? To kind of talk through, well, what might something look like? Is there a way to revisit some of these things?
That's a great question, because we don't have, we haven't really designated who that central point of contact would be. And so people are, and I know this is frustrating because we've had individual business owners who have called multiple people at the city kind of floating out their idea. I would say that that those could be, I'll just go on a limb here, those could be directed to me via email at mlsmith@springfieldmo.gov, and I will collect those, and then our team can talk about that. And when I reference our team, it is the health department, me from planning, the manager's office, public information, of course, the mayor and council are involved in that as well.
And I'll just chime in here too, that if you're a business and you have thoughts on that, or you think there may be a way here and you don't know where to go, you can also come to the chamber. So our chamber team is here. We certainly will work alongside you and try to coordinate with the right officials at the city or county level to help pitch those possibilities as well. You have our contact information at springfieldchamber.com. You can find our public affairs team, certainly Sandy Howard, Emily Denniston, Lauren Musto, who you are coordinating with in terms of this call. If you are emailing questions, those are all good contacts for you as well. A quick technical question on this one, and this is I don't know if this is Mary or Katie, but either one of you, please jump in on that. There's as you know, some of the surrounding municipalities have their own their own orders, and they aren't always exactly the same. So, for example, City of Republic has taken an approach that's less restrictive than Greene County's approach, but the City of Republic is inside Greene County, or part of it is anyway. So what takes precedent in a situation like that? Is it the city or the county when they're in conflict with each other?
Well, that sounds like a lawyer question.
We need a lawyer. Sorry to stick you. This one just came over the line, so I didn't know if somebody.
So both Republic and Springfield are charter communities, and so our orders would take precedence over the county.
Okay. All right. So that makes sense. And if it's outside of a charter community, the answer might be a little bit different than that potentially, but that's a good question for us to pursue as well. So,
and
well,
I think, Matt, just to add one quick thing on the as far as the orders go, I think, our whole hope on that was that we do help adjust for capacity. And I think hopefully that, that is one of the big goals in sort of determining solutions moving forward, is that we keep sort of the public health and the exposure in mind as we move forward. And I think that will help us at the health department continue to be able to manage the disease. And so as far as other orders go, I just hope that people would keep that in mind. But I think Mary's right.
In a situation like this, most businesses certainly they want to get up and running if they're not already, or operate in a way that can help, keep providing those jobs for their employees. But they're very focused, and rightly and understandably so. They're very focused on the particulars of the order, what I can and can't do. And in some cases, they're focusing on what I think I could do if we could work out an arrangement for that. But it's sometimes helpful to take a step back and just remember what we're trying to accomplish here. So I've heard you, Katie, describe this, and Clay and John at the health department, about how, if you're trying to understand why this business and not that business, it's not really a fairness conversation. There's really nothing particularly fair about any of what we've been doing in this process. It's more about infection rate and exposure. So, for example, if you're getting your hair cut and you happen to be sick, you don't want to expose anybody, but in that case, you'd be exposing one person at a time. If you're in an environment with a room full of people, it's just a very different, exponentially different consideration.
Right.
What can people be thinking about, Katie, that helps them kind of understand the process better? Why this and not that?
I think that's a fair assessment, and I think Andy and I touched on this earlier, but the unfortunate part of this disease is that we do have people who are asymptomatic, and so therefore do not know that they are spreading disease. And so we've made this ask before, but sort of approaching the situations like you just don't know if somebody is coming into your place of work and could be potentially a positive case exposing others around you. So where you have lots of people gathered, if you had an asymptomatic positive person, that is a potential big risk for exposure. And we just don't know how yet to avoid those situations. And so we're asking people to approach them with the assumption that people are sick. And so that really helps frame your decision making, and I think that can help. And I'll offer the same as far as moving forward. If people have questions and we can help think through different scenarios, by all means, we're happy to do that, and people can reach out via phone or via email. My email is ktowns@springfieldmo.gov, and I'm glad to help with either myself or helping connect with some people on our team that will be able to walk through scenarios.
Well, I just want to thank you so much for being with us today and for the work that all of you are doing. Mary Lily Smith, Katie Towns, Andy Hedgepeth for being on the call today with us. Unfortunately, our time is up, and we couldn't get to all of your questions, but we do appreciate those who are tuning in, and especially appreciate you for being our guest today. And so as we wrap up the program today, I just want to share a few important things before you sign off here. It won't take just a minute. First, again, thanks to everyone for being guests here, and for our members for lending the expertise. We were well over 200 people on the call today. Thanks to all of our members for joining us today and for your questions. We know you are working very hard to deal with many challenges and are now working through many uncertainties that you never anticipated or could have imagined. as we begin to reopen our economy. And right now, our main priority at the Chamber of Commerce is to bring you the timely information and trusted resources that you need to get through this crisis, while also serving as your trusted advocate. So I would encourage you to keep visiting our website at springfieldchamber.com/coronavirus for new information that comes every day on that site and new resources to aid you and your business. One item that I specifically want to highlight is a guide for employers that we put together for some things to think about as you reopen or even reconfigure parts of your operations. You can download that resource off of our website. That guide is available to you as a PDF. Additionally, please stay tuned for upcoming events that are already in the works as well. I'll also encourage you to download that square footage calculator that's available. So if you don't know how many customers can be in your building at any given time, we have on that springfieldchamber.com/coronavirus site, we have a downloadable calculator tool that you just have to put in your square footage and it'll tell you how many customers you can have in your building. Also want to encourage you to please reach out to us with your COVID-19 concerns, experiences, and challenges. The feedback from our members is directly informing us on what you need during this most critical time. It's informing our advocacy on your behalf. And you can share your feedback with us at the email address covid19info@springfieldchamber.com. As so many of you work to reopen after many weeks, just know that our team is here to support you. We're working to provide resources, advocating on your behalf, meeting your needs of the current moment, whatever those may be. And we're here to do all we can to help you come out of this unprecedented time successfully and to thrive in the future as we move forward. We're so grateful for your membership, and I want to thank you for being a part of the Springfield Area Chamber of Commerce.